So a big challenge with implementing clinical pharmacy services in the outpatient setting for a long time has been low reimbursement rates for the services that pharmacists provide in the outpatient setting. And so with the creation of the Medicare annual wellness visit, which came about with the Affordable Care Act in 2010, it presented an opportunity for pharmacists to not only provide this service and provide better care for our patients, but also provided a reimbursement opportunity, because what's unique about these visits is that any provider who provides the annual wellness visit gets reimbursed at the same rate as if a physician completed the visit. From a physician's perspective, it gave all of our Medicare patients the opportunity to have their medications reviewed by a pharmacist, and that patient population being high utilizers of medications and there being lots of high-risk medications in that patient population, it presented a really nice opportunity for us for multiple reasons.
I think when physicians are doing annual wellness visits, there's so much competing need from the patient that oftentimes what was happening in reality was that the real parts of the annual wellness visit weren't being done as well. And this has absolutely borne out for us that since the pharmacists have taken over the annual wellness visits, they're actually done much better.
And the nice thing about having a pharmacist do this is I can listen to those concerns and make sure the patient knows that I'm hearing their issues, and then schedule a follow-up visit with a physician in the next couple of days. And at that point, they'll have all of their records up to date. They'll know all of the issues that we have identified. And then it's perfectly segues into the visit with the physician where they can address all those chronic conditions. So it's a nice partnership.
One of the challenges that I've seen, particularly in rural Western North Carolina, where resources are limited and primary care physicians are limited, is that the physicians out there in those practices have been doing it on their own for so long that the idea of having someone else come in and help them out is just very hard to conceptualize. And so I think helping them realize that this is to aid them, not to take something away from them, is a very challenging concept for folks who have been out there doing it on their own and doing a reasonable job for a very long time. So the question becomes, why do I need to change what I'm doing?
The barrier was not there for very long, because quickly I recognized the skill set of these pharmacists that I was working beside, the depth of that skill set, and that it was absolutely complementary to mine, that there were places where they had knowledge that I could tap into that was really helpful to me. And definitely there's places where I'm trained to do things that they don't know how to do. So once I saw the depth of the help that I could get, then my thinking really turned to how can I access that help. So I was the person who was calling my patients and saying, hey, I want you to come and try this annual wellness visit with the pharmacist, because I knew once we got some traction, once my patients started doing it, they would see the value of the pharmacist as well. So that was a piece of it. So it was my buy-in first, and then it's my patients' buy-in, and the patients don't want to feel like they're going to have less time with me as a result of me asking the pharmacist to do this task. So I sold it to my patients honestly, not in any way dishonestly, that this is now an added benefit to you. This is a member of the team of people who's going to take care of you in this office. And this does in no way replaces me, and in fact takes certain things off my plate so we can talk. I can sit with you and you can tell me what's really going on. Medicine is changing. It's changing, from a solo effort to a team sport. And I'm very much aware of this because we're training residents somewhat simultaneously in the old way of doing things and the new way of doing things.